If you were critically injured or ill and you were in the emergency room, what would you think if your physician in their white coat turned their back on you and marched right out of the room because there was something about you that offended them? Would you feel abandoned? Sure you would. Well, we're starting to get a glimpse of what happens when the woke generation enters into medical school. Last week at the University of Michigan at their College of Medicine, they were having their white coat ceremony. And the white coat ceremony is when you invite your family, you invite your friends, because this is a major accomplishment and you want to celebrate that you are entering into an honorable profession and you're going to be taking care of patients. You might even recite the Hippocratic Oath at your white coat ceremony. Well, the invited speaker was Dr. Kristen Collier. Dr. Kristen Collier is well loved by her patients, respected by her colleagues. She practices high quality medicine. The university had asked her to come and be the guest speaker. Well, Dr. Collier has this radical thought. She believes that she needs to work to protect and defend the lives of her patients, that life is precious. And here's the wild thing, she includes the lives of babies in the womb, because they are patients as well. Well, a lot of the students were offended by the fact that she is pro-life and she wants to defend patients in the womb who have a heartbeat, who are moving around and can be diagnosed and treated in the womb. So how did they respond? Did they use critical thinking? No. Critical thinking is when you look at the who, what, when, where, why. You look at the facts, you do your research, and you eliminate bias. These students are filled with bias now. Did they use critical thinking? No. They have only been taught to be critical. Well, the thoughts and the beliefs of Dr. Collier, who hadn't even started to speak yet, offended them. And so how did they respond? They responded by standing up, turning their backs on Dr. Collier, and walking right out. They're going to do the same thing in medicine. If you offend them, they're going to turn their back on you and they're going to walk right out. They are not going to treat you as a patient because you offended them. They are not critical thinkers. They are just critical. If I had walked out and turned my back on a professor when I was in medical school, the dean would have met me and said, I understand you want to walk out of this ceremony. I suggest you continue walking because you are not part of this university. If you will turn your back on a professor, you will turn your back on a patient, and we do not want doctors taking an easy way and abandoning their patients. It's an honorable profession, and we need to meet the needs of all of our patients, regardless of a t-shirt they might be wearing, or jewelry they might be wearing, or comments that they have made, or beliefs that they have. That is not the medicine that I want to practice. We are treated as patients because we are persons, and we need to respect all people as physicians and treat all of our patients equally, not turn our backs, walk out, and abandon them. If you have any questions, you can contact me at my website, which is prolifedoc.org. We need more critical thinking and less critical. God bless you all and have a great day.